Robert Murphy is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Well, some good news in the numbers. Also hearing about a third wave in Europe and a spike in Michigan, a couple other places. Where are we in the scope of things here as we head into spring break?
We're just at the point of sliding backwards, unfortunately. The Europeans, they went into reverse, a few weeks ago, and now you have France and Italy basically completely locked down again. Spain's locked down except for Madrid. The U.S. may be next. We'll have to watch these numbers very closely, but like as you said, Larry, 50% increase in cases in Michigan. The Illinois case rate yesterday was much higher than it was in the last few days. I hope these are little blips, but if they're not, action has to be taken.
Dr. Fauci said no herd immunity, or he doesn't expect there to be any until all the kids are vaccinated. Do you agree with that?
You have to read between the lines in these government public health officials. They do everything in an orderly fashion, and after everything has been really examined closely. But to state that children have to be vaccinated before we can reach herd immunity means somebody someplace knows that herd immunity is going to be over 80%. That's actually what this statement means. It means either that or there's going to be 25, 30% of the people that refuse to take the vaccine. And that's another giant limitation, or it's a combination of the two. It's a very unfortunate statement. I mean, the data are unfortunate, not the person stating it, but it's disturbing.
Well, back to the theme of spring break. I saw the study out of New Zealand that said they found COVID spread on planes and in hotel corridors. And, you pair that with, we thought we were kind of past COVID being on surfaces and washing vegetables and all that. So what does this study mean?
Yeah, this is the study it was a 1/3 full airplane coming from India to New Zealand. They were wearing masks, a lot of space on the airplane. They got in, they did everything right, and still, obviously, some people slipped through that were infected. And they infected 9 people that they came in contact with, and then those people went on to infect people. But because the caseload is so low in New Zealand, they could actually track everybody, which was really, quite cool from an epidemiological standpoint. And they found one case tracked where somebody opened a door in a room, it was open for 50 seconds, and that person on the other side got it.
Oh, boy.
So very, very, very good scientific tracking, very disturbing. But most likely this person, we're talking about super spreaders. Remember, it's not the average person that is spreading this around. It's these super spreader people that, can give it. There's other cases. A case in Boston, Larry, at Biogen, where the woman reached behind her to grab something off the table and the guy behind her got it.
Wow.
It's crazy cases like that. But this is why we have to be vigilant in this thing, and that's why the worldwide case numbers are up 10%.
All right, let's get to some viewer questions. Why are we opening up eligibility for the vaccine to more people when those at greatest risk can't even get an appointment?
Well, we're at the point of your crystal ball. Like, where do I get my vaccine? You're going to have to. That's basically what's going on now. This chaotic approach is based on supply and demand figures that were figured out by the U.S. government based on population. So then it becomes a supply and demand situation. So the city is handled separately from the state of Illinois by the U.S. government in terms of vaccine delivery. So the demand is much higher in the city of Chicago than it is for the rest of the state, which is 100 counties. That's 350 miles long,
Yeah.
So it's basically just supply and demand, but, it doesn't make any sense. Like, why can you get a vaccine in Evanston, Oak Park, or Flossmoor, and you can't get it in Lakeview or Chatham or, whatever?
Yeah.
So I don't understand why there isn't more sharing between the states that have too much and the states, the districts that have too little. How hard It's just not that hard.
All right, next question. This time last year, we were all about flattening the curve. How did we do? Do you have some lessons learned to share?
Yeah, we failed. We flattened the curve when it was still too high. We didn't do what Australia, New Zealand, and Taiwan and those countries in the Asia region did. They got the curve down to almost zero. We just let it, it's not 100,000 cases a day. It's only 50,000 cases per day or whatever. That's too many. You can't track people with that amount of virus going on. So we didn't go far enough. That is really what the lesson that we learned, and then we didn't do anything about it.
All right.
We didn't do enough about it. Not anything. We tried.
All right, thanks, Dr. Murphy. If you have a question for the doctor, you can post it on our Morning News Facebook page, and we'll talk to him again Monday at this time. Doctor, thanks for being with us.
Well, thank you. Have a great weekend.
You
Thank
too.
you.
Hey, Paul.
Hi, you guys. We're going to see sunshine across Chicago.